Hi everybody and welcome back. What I wanted to talk about this week was a little bit of how you can live pain-free. Since I'm having my Live Pain-Free seminar next week, you're all invited, by the way, December 4th, 9:30 a.m. I'd love to see you there. And if you're not in the area, eventually, yes, I will have this online and you can tune in too as to how you can live pain-free. So very often as therapists, what we teach in posture alignment therapy is that where we have the most pain is very often where we think our issue is or where our problem lies. And that is often not true. So what I'd like to talk about today is how does pain show up in our body? What does it do? And what is our reaction to it? So, and this week, it seemed to be that I had a few discussions with some amazing people in my life that are going through some challenging times. And it's funny how we all deal with pain in a different way. I know even for myself, and I'll just talk for myself, when I've been in pain, very often the first reaction is I want to numb that pain. And I'm talking about emotional pain. Something hurts you, you want to push it away, you want to push it down, you want to avoid it, you want to sleep, eat, or drink, or do any kind of action to numb that pain. Well, it's very similar with our physical pain. And unfortunately, that's also what we are doing today as a society. We get a shoulder pain and the first thing we're told is take an anti-inflammatory. Now, very often it's true. We do need to take some medication, and I'm not an anti-medication person. The thing is that at what point are we really going to deal with that pain? And how are we going to deal with that pain, whether it be emotionally or physically? So let's just talk about posture. In posture, we look at the body as a whole. So there's a shoulder pain, but we also notice that the hip is elevated or rotated. We notice that the kneecap is turning out, pointing towards the east when it's supposed to be pointing straight forward. We notice that the toes are pointing outwards rather than pointing straight forward. And how is that all related to the rest of the body and my shoulder pain? Well, it's very related. Very often where the pain is not where the problem actually began. It's just where the symptom came up. It's kind of like having an argument with your mate when you're pissed off about something else. You're not really upset with your mate or your friend or whatever it may be, but something else is bothering you. It's kind of brewing inside, and then boom, you just explode with that person, or you have this argument with that person, but it had nothing to do with that person. That's kind of like what shoulder pain or knee pain is when it's just a symptom of other things going on. So in posture, what we do and what I'd love to educate you on give you a little bit of insight on Thursday about is exactly that. How does the whole body function as a whole? And how do we unravel all of that which we see in the body? So a little test, I'll be doing a few tests with you on Thursday, and that's what we do in the clinic and in posture alignment therapy is we test how does the rest of the body react? How is the rest of the body functioning? Is my left side and right side twins? Is the front and the back doing the same job as it's supposed to do? Are the muscles that are supposed to be this long that long? Are they too long? Are they too short? These are all questions that we ask and how we help to unravel pain. So this is again a little invitation and a little bit of insight as to what I'll be talking about on Thursday morning, and I hope to see you all there. Thanks and have a great day.